Good evening, respected dignitaries, esteemed members of South African TIBB Association, IBNE SINA Institute of TIBB Health Sciences, and dear colleagues. I am Dr. Hina from Delhi, a skin specialist and cosmetologist, and I am practicing since 2005. It is a privilege to be here today, and I would like to express my heartfelt gratitude to South African TIBB Association and especially Dr. Taira Manuel for welcoming me onto this platform. I deeply value this opportunity to connect with you all, and I share my knowledge and experience. So today my topic is melasma or hyperpigmentation. In Unani TIBB it is known as kalf, kalaf, kala or kalu. Barse aswad, that is freckles, also called mask of pregnancy, mostly common in pregnancy, that's why it is called mask of pregnancy. But during pregnancy, if it happens, it goes 70% of the marks go after the pregnancy is over. Definition, if talking about its definition, it is a form of hyperpigmentation that appears brownish, grey, brown patches on the face. Common sites are cheeks, forehead, nose, upper lip, chest and forearm with irregular border. It is associated mostly with women and with hormonal changes, sun exposure and heat. Unani concept of pathogenesis, that is asbabe murakkaba. Unani medicines attributes melasma to number 1 sue mizaj, that is derangement of temperament, particularly har ratab, dambi or sanguine, cold or dry, that is sodavi or melancholic, and stimulation of choleric humor, that is khilde safra ki tahrik, which is very common nowadays. Mostly if you see nowadays the melasma occur due to the derangement of this khilde or tahrik of this khilde safra, which is my experience also. It is very common. Imtala, that is accumulation of morbid matter in the blood or skin. Pelgum is most of the time not directly related to the melasma, but when it happens, it occurs due to the retention of moisture in the skin, which may congest the skin pores and trap the waste material, leading to the patchy discoloration. Number 3 is galba soda, that is dominance of black bile in the body, and number 4 is hararate shams, that is exposure to sunlight. And here I mean exposure to sunlight and heat. Heat may be the kitchen heat also, or maybe the person is working in the environment where the temperature is high. Now modern Unani understanding of causes. Number 1 is hormonal imbalance, especially in pregnancy and menopause. Second is liver dysfunction, which is related to safra and soda humor. Whenever you are treating melasma, always consider liver dysfunction. Stress and emotional disturbances affecting nafsiyati mizaj. Digestive disturbances causing accumulation of toxins, and along with this, too much salty, spicy and sour food items. Facial exercises like singing, reading, speaking loudly after food. So this is very important point. I mostly consider these things and ask it to my patients also. Energy of our body is focused toward digestion after food, especially toward the stomach and liver, and speaking loudly after the food and singing and pressurizing the face muscles leads to divert this energy, resulting in weak digestion, that is zofe hazm, causing derangement of phalgum and black bile. When a person shouts loudly, body heat distribution gets disturbed, which further disturbs the melanin activity. Fear, anger and grief. Here I would like to explain that if a woman cries daily, she will surely develop pigmentation. insomnia, lack of sleep, chemical hair dye. Chemical hair dye, especially if the person is using chemical hair dye since long time, he or she will develop pigmentation near the hairline, especially over the forehead and sideburns. Makeup allergies, chronic anemia. Chronic anemia is also very important point to be considered. Endocrine disorder, that is thyroid dysfunctions, ovarian disorders, adrenal gland disorders, and hormonal medications. Maybe the patient is over contraceptive pills. So you have to keep all these points in mind while attending the patient of melasma. Now, Unani diagnostic tools. Unani diagnostic tools. Number 1, misaj or temperament. Number 2, nerves, ball or baraz or pulse, urine and stool. Number 3 is laune bashar. Laune bashar, that is skin color and texture. And number 4, tashti is diagnosis based on external and internal factors. Differential diagnosis as per humor. So here I had made a brief table, but I would like to explain this table in a proper way so that the point will be clear to you. Now, so there are 4 humors: melancholic, choleric, phlegm and sanguine. So let us start with the pulse. So pulse of melancholic is thin, weak and irregular, and of choleric is rapid and bounding. For phlegm it is slow, moist and low volume, and for sanguine it is full, strong and fast. So pigmentation, color of hyperpigmentation, if the patient is having a Sodavi temperament, or if the patient this humor soda is involved. Now the color will be grayish or dark bluish, and in case of safra it is reddish brown and coppery, and in case of balgam this is dull brown or pale brown, and in case of dambi or sanguine it is reddish or pinkish patches. Nature of the pigmentation. So in case of Sodavi derangement, it is nature of pigmentation in case of Soda is deep rooted, chronic, slow spreading, and in case of Safra or choleric it is acute onset, worsen with heat and sun. In case of phlegm it is moist, dull pigmentation, and in case of dam it will be vascular looking melasma which can bleed easily, and the mostly such patients have a flushing face. Worsen with, how this pigmentation get worsen further. Now stress and depression and constipation, these things worsen the pigmentation which involves soda, and sun exposure, spicy hot food and anger. These worsens the pigmentation involving safra. In case of phlegm it is cold and damp weather, dairy and oily food, and in case of dam it is excessive heat, sexual activity and rich food. Associated symptoms are insomnia, fear, sadness, constipation and dry skin in case of soda or melancholy. In case of safra it is burning sensation. Mostly nowadays safra is involved, as I told you earlier also, that in case of Safravi pigmentation patient always complained of burning sensation and anger and thirst and heat in palms and soul. In case of balgam there is heaviness, laziness and mucus and the signs of cold limbs. In case of sanguine it is flushing and bleeding gum and hyperactivity. Nature of stool. Nature of stool in case of soda is hard, dark and constipated, loose yellowish in safra, and slimy white coating in case of balgam. In case of gum or sanguine, it is slightly loose and of red tone. Tongue coating is blackish dry in case of soda, and it is yellowish dry in case of safra, and white and moist in case of balgam, and red and congested in case of dum. Favorable essential oil, if you can say, in where there is a sodavi pigmentation, these essential oils are very much helpful in recovering the patient from this problem. Frankincense, myrrh and lavender for sodavi pigmentation, sandalwood and lemon for saffravi pigmentation, for eucalyptus and thyme for balgami pigmentation, and rose and chamomile for dambi pigmentation. Now, favorable diet are dates and papaya for sodavi, barley water and rose for safra or choleric, and methi dana, methi, fenugreek greens and cinnamon for phalgam, and pomegranate and green tea for dum. Now, Unani management of melasma. इलाज बिल ग़िज़ा और डाइटोथेरेपी. Avoid spicy food, sour food item and hot food item. Excessive intake of meat, eggs and salty food. Recommended diets are food rich in antioxidant like grapes, figs and pomegranate. Detoxifying foods like trifle or trifla, kulti dal or horse gram, and leafy green vegetables. Number 2 is ilaj bil dawa. For safravi, there is a line of treatment tanqiya and tasfiya. Sharbat-e unnaf for tanqiya, jawarij safra shikam for tadil mizaj, and mazun uzba for skin clearance. Now talking about sodavi or melancholic, it is itrifal shatra for tanqiya, purse muqil for tadil mizaj, and arq shatra for skin clearance. For balgami pigmentation, it is itrifal ustuquddus for tanqiya, jawari janjabil for tadil mizaj, and lauq sapista for skin clearance. For dambi, sharbate dinar for tanqiya, sharbate sandal for tadil mizaj, and sharbate neelufar for skin clearance. Now, external application or zimar. This is very popular, and patient also get satisfied when you give her something to apply. White sandalwood powder 5 grams, red sandalwood powder 3 grams, and fuller earth powder 5 grams. Make a paste in rose water as per requirement and apply it until semi-dry. Wash it off after that and without rubbing. The next formulation is, it's a simple formulation. You can keep all these things at your matab and give it to your patient. Mulethi powder, lodh pathani, simploccus bark plus barley water. Make a paste in barley water and apply it for 20 minutes or semi. Wash it off after some time. Face pack number 3 is for skin clearance and for very clean skin. Mostly you can use it for acne spots also. Etrifal powder, multani mitti powder, vetiver or ushira, and turmeric powder in equal quantity. Make a paste and apply it on the pigmented area and until semi-dry, and wash it off without rubbing your face. All these face packs are used along with medifacials at my clinic, and you can also use with excellent results. Other than this, alum water can also be used to for the open pores, to constrict open pores, and buttermilk to for face toning. Modern Unani integration. Unani practitioners today may combine laser therapy, chemical peels and with Unani herbal protocols. Cosmeceutical formulation with extract like liquors, neem, aloe vera and saffron. And medications like different types of massage therapies like Kotli massage, crystal massage, stone massage, wood massage are becoming very popular nowadays. References from Unani literature. So these are the books where you can find this topic in scattered form by different name, as I have told you in the beginning. Number 1, Al Qanun fil Tibb, Kitab Al Hawi, TIBB Akbar and Bayaze Kabir. In Bayaze Kabir you will get lot of formulation for melasma. So before I conclude, I would like to share my small contribution in the management of melasma. I have formulated a herbal carrot cream which I have prescribed to the number of patients with excellent results. I am using this cream since 5 years and I selected carrot extract because it is rich in beta carotene and antioxidant that regulates melanin and brightens the skin. Lavender essential oil soothes the inflammation and almond oil nourishes the skin. Jojoba oil balances and protects the skin barrier. I like the jojoba oil because it is the lightest one and it helps the penetration of the main ingredient. Together, these natural ingredients provide safe and effective results, helping the patient restore both skin health and confidence. Thank you so much.